Well, I've been doing this a long time, 35 years since I finished my fellowship, and a lot has changed during that time. One thing that hasn't changed, are the need the patients have when they come to the table, the new consultation. It's exciting because you can see the concern, you can see the anxiety and the stress. It's universal. I've had a very unique career. I tend to attract patients that have oftentimes been told that there is nothing you can do for them. That's been sort of my legacy in the field. So as part of our affiliation with Rutgers, I see patients here 1 day a week in Basking Ridge, and I also work with the fellows here, which is exciting. So it gives patients the most advanced reproductive care you can get by people that are extremely well educated in the field. But they also have a teaching and research focus that you don't normally get in most of the private practices. Fertility doesn't take a vacation. A lot of these patients have real needs, talking patients with cancer, patients that are older. They really need to get these things done, and they need to get it done fairly soon. We saw some of this during the pandemic where there was pressure to close down these elective centers to do fertility care, when in fact, if anything, I think we had an imperative to stay open and continue to serve the community. Just like in obstetrics, the babies are still coming in every day. So you really have to be available to treat the population at large. Well, it's interesting these days. Some of these patients, I actually get graduation announcements, and even from college, if you can imagine. It's exciting. It's fun to watch them grow. It's a gift that keeps on giving, I oftentimes think about that. The children that were oftentimes held in a IVF transfer catheter at one point and placed into their mother's uterus are now growing up and having children of their own. And that's pretty remarkable when you really think about it, how the impact on not just one person or a couple's lives, but a whole generation or two following that.